All right, today we are diving into something you might have seen but never really knew what it was. We're talking about oral hemangiomas.
You know that moment, you're just like brushing your teeth, you look in the mirror, and bam! There's this weird dark, purplish or reddish spot that you swear wasn't there yesterday. It can definitely make your heart skip a beat, right? Well, let's figure out what that might actually be.
And here we have it. This is a super common oral hemangioma. It's got a really distinct look, doesn't it? So the big question is, what is this thing? Let's get right into it.
First up, a common oral spot.
Okay, so here's the deal. A hemangioma is basically a benign, and that means non-cancerous, malformation of blood vessels. That word, benign, is the absolute key takeaway here. It's not a tumor in the scary sense. It's really more like a little tangle in the plumbing, you know? The blood vessels just got a bit jumbled up as they formed.
But, not all of these spots are created equal. They basically come in two main flavors. You've got capillary hemangiomas, which are made of tons of tiny little vessels, and then you have cavernous ones, which are made of bigger, wider blood vessel spaces. And really, that difference in plumbing, small pipes versus big pipes, is exactly why they can look so different.
So, what does it look like? Let's get visual.
Now, these things can technically pop up anywhere in your mouth, but they definitely have their favorite hangouts. We're talking about the tongue, the lips, and the buccal mucosa, which is just the fancy term for the inside of your cheek. Check this out. Here's a perfect example right on the tongue. You can see how it's this kind of smooth, bluish swelling. It actually makes a lot of sense, because the tongue has a ton of blood vessels, making it prime real estate for these things to form. And here's another super common spot, the lip. See how well-defined this one is? It's like a distinct, raised, purplish bump. And yeah, because of where they are, these are the ones that can sometimes be a cosmetic thing, or worse, you accidentally bite them. Ouch.
And finally, let's look at the inner cheek. Again, you see that classic bluish, raised look. So while the shape and size can be a little different from person to person, they almost always have that same signature color, that same look that just screams, I'm a collection of blood vessels.
All right. Get ready for this next part, because it's really cool. There's a super simple test for identifying one type of these, and honestly, it's kind of like a magic trick. We're calling it the disappearing spot test.
So how does this little magic trick work? Well, when a doctor wants to confirm they're dealing with a cavernous hemangioma, they can use this really clever, and I mean surprisingly simple, test.
Okay, the official name is the diascopy test. And it's so easy. All they do is take a clear glass slide and press it firmly against the spot, and they're just watching to see what happens to the color. Specifically, they're looking to see if it blanches.
And boom, here it is. Look at the image on the left. That's the spot, just sitting there. Now look at the right. When they press down with the slide, poof, it almost disappears. It blanches or fades away. So why does that happen? It's simple, really. You're just temporarily squishing the blood out of those jumbled up vessels. That fading is the telltale sign of a cavernous hemangioma.
Okay, so you've identified it. The next logical question is, so what do we do about it? Let's talk about when and if you need to treat it.
And here's the best news of all. For the vast, vast majority of these things, you do absolutely nothing. You just keep an eye on them. That's it. Now, if it's in a spot where you keep biting it or it's causing other problems, then yeah, there are options. Small ones can be surgically removed or frozen off with something called cryotherapy. For the really big or deep ones, that's when you need a specialist to handle it with more advanced techniques.
So knowing what this is, that's step one. But what's the next step? Well, if you see a spot like this in your own mouth, the single most important thing you can do is get it checked out by a doctor or dentist. They're the only ones who can give you a real diagnosis and, most importantly, give you that peace of mind. So, stay curious and stay proactive about your health.